What is the best way to heal from sciatica and nerve damage? What is the research-backed way to speed up your recovery from home? Is it even possible to heal from nerve damage? Let's get into it. I'm Dr. Anthony Davis, and I empower people with chronic low back pain and sciatica to reclaim the active life they love using an integrated approach to rehab. Now, my last video showed you the 3 major types of nerve damage and the statistical chances that each of them will heal, including recovery time. If you want all the juicy details, I will link to that video right here. Most sciatica involves neuropraxia, which is good because that means that the nerve can heal completely. Let's talk about how to actually heal those nerves at home. What can you do on your own in order to speed up recovery and improve the chances of a full recovery? First, we want to remove anything that might be aggravating that nerve over and over. So stop forcefully stretching that nerve over and over again. Stop cranking and yanking on it. You might want to work on strengthening the body, improving mobility, and maybe loosening up some tight muscles. Shake off the cobwebs and do your best to find exercises and movements that help to reduce the shooting pain down the leg. Now, if you can't pin down the cause of your pain, or even if you have an MRI and you know you have a disc herniation, we're going to want to focus on your overall health and well-being. Now, to be clear, most disc herniations do not require surgery. And we know this because most people are walking around with a disc herniation and they don't even know it because it's not causing pain. Now, the only exception to if a disc herniation really matters is if you have progressing weakness in your feet and muscle atrophy or loss of control of your bowel or bladder, or saddle anesthesia, which is numbness and tingling where the groin is or where a saddle would be if you were riding a horse. If you have any of those symptoms, definitely tell your doctor about it and make sure there's nothing serious that you need to worry about. So surgery is rarely needed. Instead, exercise, stress management, good recovery using sleep and nutrition, these are the best treatments. You need to move your body on a regular basis. You need to eat nutrient-dense food so you can recover. We want to try to avoid alcohol and drugs. We want to get 7 hours of restful sleep and take care of your mental health. If you're able to form a plan to do these things and get the support that you need to stick to the plan for long enough, then you're very likely to make a strong recovery. Exercise has been shown to be especially helpful for nerve pain. One systematic review found that a combination of endurance and sensory motor exercise improved balance, quality of life, and nerve conduction velocity, which is a measure of how healthy the nerve is, in patients with diabetic-related nerve damage. And another systematic review zoomed out and looked at the impact of exercise on general neuropathic or nerve pain from things like multiple sclerosis, Parkinson's, peripheral neuropathy, sciatica, or radiculopathy. And we found across the board that exercise helps to reduce the intensity of nerve pain. And interestingly, the type of exercise didn't seem to make a big difference, right? We had resistance training, aerobic exercise, stabilization, Tai Chi, and yoga, and all of them seemed to be pretty helpful. And then when we look at sciatica specifically, again, we see that exercise helps to improve the health of the irritated sciatic nerve. Now, you may have heard of some different specialized exercises for sciatica. It might be things like the McKenzie method, which often involves a lot of spinal extension or backwards bending, or things like neurodynamics, like nerve gliding or nerve flossing or nerve tensioning, where you floss the nerve back and forth. Or you may have been following Dr. Stuart McGill and bracing your core because you don't want to bend the spine because otherwise it's going to make your discs blow up and explode. But the truth is that these exercises don't actually give additional benefits when you're comparing it to just normal exercise. Now, I wish we had more research on these comparisons, but this study compared 2 groups of people with sciatica, and one got 7 sessions of McKenzie exercises, and the other got a single session of self-management guidance. And interestingly, there was no difference between the groups. So it appears that knowledge is power, right? And that's why in the Beyond Back Pain program that I work with my online clients, I put so much emphasis on education and self-management strategy, because there's no magical exercise that's going to magically cure sciatica for everybody. The trick is in finding something that you can do that is tolerable in your body, and that's going to look different for everybody. So McKenzie exercises can definitely help, but you could also get the same pain relief from just doing normal general exercise at home, which is a great thing because that means you don't need to pay to go to physical therapy 3 times a week for months on end. That you could get the same relief from having guidance, a clear step-by-step exercise plan, and accountability to actually do the exercises that you need to do. So what about neurodynamics? So this study was interesting. It showed that nerve glides and nerve tensioners did in fact relieve sciatica when compared to using a TENS unit, which is like electrical stimulation of the muscles to make the muscles contract over and over again. So I guess you could say that nerve glides are more effective than a TENS unit or electrical stimulation, but we have no good evidence comparing nerve glides to general exercise to see which one would be better. My prediction would be that if you actually put it up against a study where one group in the study did real meaningful strength and conditioning, we tried to find the most difficult exercise that you could tolerate that did not make the nerve pain worse, and we focused on full body strength and resilience, my prediction would be that that type of program that looks at your whole body and makes your whole body strong would probably do better than a program that all they do is stretch a nerve, right? We need to zoom out. So yeah, I guess you can use McKenzie exercises and nerve gliding as part of a home rehab plan, but it should only be one part, right? The focus should be on getting your whole body stronger. So we really need to do functional movements like squats, like deadlifts, like walking, because otherwise you won't be able to pick things up off of the ground or get up and down off of the ground or go anywhere. If you can't do those movements, you're disabled. So again, full body strength needs to be a priority. And you need to find something that's not too easy, because if you do too little for too long, your body gets weak and then pain is worse. But if you skip steps and you do too much too fast, then you're going to get re-injured. So you find some type of exercise that might be outside your comfort zone, but not so much that you get re-injured, and then gradually increase the intensity over time. And then if you have time or you feel like it, you could absolutely incorporate some other pain management strategies like massage or chiropractic, acupuncture, ice, or heat. But you have to understand that these things are only short-term pain modifiers to help you get through the day. These things alone are not a long-term strategy to make you stronger and more capable and help you heal and get back to the active life you love. So just make sure that the main treatments that you're using are real lifestyle changes and exercise. Now, again, the biggest difficulty here is that some people are going to shy away from exercise because they're afraid they're going to get re-injured. In that case, you're not going to make any progress. You won't get stronger. You won't get better. And some people ignore pain. They get excited. They skip steps and they dive in. They do way too much too fast and they just keep getting re-injured. So if you need help getting a solid plan, I design rehab plans for people all the time. Just start by watching the masterclass. The link is in the description. It'll teach you everything you need to know. Now remember, most sciatica is caused by neuropraxia, which almost always is going to heal. So you really don't need to worry about whether or not you can heal. It's about doing the right things so that you can heal faster and not let sciatica just derail your life while the nerves are healing. But if you happen to be unlucky enough to have sciatica or any other condition caused by a more severe type of nerve damage, which would be axonotmesis or neurotmesis, there are still things that you can do to help your chances of recovery. Step 1, you should consult a neurosurgeon to just see what they say, right? I'm always trying to get people to avoid surgery whenever possible, but admittedly, sometimes in very rare cases, it is a lifesaver. But if you're going to ask a neurosurgeon anything, please do yourself a favor and get at least 3 different opinions. Step 2. Now, do everything in your power to help that nerve regenerate. Remember, you have about a year until your muscle is fully atrophied and 2 to 3 years until the sensory organs, your sensation, is toast. Now, this systematic review showed that patients with peripheral nerve damage who received electrical stimulation did have better recovery. And that's because it prevented muscle atrophy. The muscle itself lived long enough for the nerve to hook back up to it and recover. Now again, this is in extreme situations where you have such bad nerve damage that you literally can't use your muscles anyway. You can't move your feet because the nerve doesn't work. So obviously it would be way better to just contract those muscles using your own strength. But if you literally cannot use the muscles without either severe pain or weakness, then electrical stimulation is a great way to start. Just remember, it's a starting place. Eventually, as soon as you can use your own muscles under voluntary control, you should graduate beyond the need for electrical stimulation. So exercise is obviously a great way to improve nerve regeneration. So if you have a severe nerve injury, we want to try to do any type of regular exercise you can. A lot of times there's a way you can work around whatever deficiencies, weakness, or pain you have and at least do some type of exercise. Maybe it's upper body exercise. Maybe it's some form of light cardio like walking. Maybe you can even get into some type of resistance training. A lot of times my patients with chronic back pain and sciatica, major sciatica, any type of like free weights causes terrible pain, but we can get them into the gym on machines where there's basically no stress on the nerve or on the spine, and they can stay strong and at least keep their muscles healthy and strong so that when the nerve does heal, they haven't become super weak from being sedentary. So basically, we want to do as much exercise as you can tolerate. And then on top of that, if you want to add some electrical stimulation at home for those certain muscles that you're having a real hard time using, then that's a great strategy to do from home. Now remember, everybody's exercise routine is going to be different because everybody is starting at a different level of physical ability and having a different pain experience. Now that said, as a guideline, if possible, we want to try to get in 150 minutes per week of light cardio, like walking or bicycling. And that would be like a 30-minute walk 5 times a week. And then if we can get in 2 sessions of resistance training per week, that could be resistance bands, it could be free weights, it could be machines, anything that you can tolerate, that would be a really great place to start. Or if that sounds like a lot right now, that would be a good goal to be able to work up to. So today we learned about how to fix nerve damage from home. We discussed popular sciatica exercise techniques like McKenzie method and neurodynamics, and we found that although they could be helpful, most people will benefit more from a whole body exercise plan and an integrative approach that includes stress management, sleep, and nutritional advice. Now, no doubt you probably have a lot more questions about really specific exercises. What about dead bugs? What about clamshells? What about glute strength? What about core strength? What do I do? Right? Because all the information you're getting on Instagram is telling you, never do this exercise or only do this exercise. And it's very confusing and it leads to a lot of dogma and it leads to a lot of fear and it leads to this obsession with doing the perfect exercise. Now, the truth about these exercises, I guarantee this is going to surprise you. So if you actually want to know what is the perfect exercise for low back pain and sciatica, then be sure to watch the video that's appearing on your screen right now, and I will see you there.